they've given me. My call to action to Mathare Hospital is that for suicide prevention, please embrace psychology together with other treatment processes. Please embrace, as a country, transcranial magnetic stimulation, which affects memory and long-term side effects less. Please introduce suicide prevention programs for different demographics, including our men. Well done, Mathare Hospital, for being the most passionate, the most empathetic, the most diligent hospital staff I have met since birth. Thank you for dignifying us. Thank you. Even with terrible facilities, terrible working conditions, I with all my heart say you're the best staff in this country. Well done. The other call of action is, as a national facility, you are our pace setters. We need you to move from good to great, to specialize, so that patients like me who have unique symptoms like altruistic suicide would be able to come all the way from Tanzania or Congo, begin to see this as a neuropsychiatric center of excellence in East and Central Africa. Rise up to the challenge. To the Ministry of Health, one out of 4 Kenyans has a mental health condition. So that means we're about 10 million Kenyans. Where is the seat for that 10 million Kenyans? In the Parliamentary Health Committee, in the board here at Mathare Hospital. Where is our seat at KEMSA? Where is our seat at every health facility in this country? We are asking that you include us as users of mental health services and caregivers. And I appreciate and celebrate the National Task Force on Mental Health for giving us the opportunity to sit in the committee. I would like to advocate that we prioritize mental health like we prioritized HIV. HIV has had wonderful milestones that we celebrate, and as mental health patients, we need mental health to be prioritized so that we can rebuild Mathare Hospital, we can improve our infrastructure, we can increase human resource, and we can improve medication and equipment. I would hate for any other patient for their kidneys to be affected like mine in 3 months because of KEMSA not fulfilling their mandate. We ask and we say that as mental health patients, we should be given our human rights. Our human rights should be given to us as persons with moderate and severe disabilities. Mathare Maximum Security Unit in this facility has 30% of patients, yet there is no single cent that's budgeted by the Ministry of Health or by the Ministry of Interior. So we are asking, in respect of human rights, provide financing for the Maximum Security Unit for abandoned patients in every ward in this hospital and in other psychiatric facilities and prisons. We ask for special registration because they do not have IDs, and we ask the Ministry of Labor and Social Protection to qualify them for disability, provide shelter, food, clothing, healthcare, rehabilitation, and where possible, resettlement for patients with severe disabilities. For we who are moderate, we need support in accessing healthcare. We need support in accessing economic opportunities, because if you do not take care of us who are moderate, then we will all be severe and we will need more help. We ask, my parents have 6 non-communicable diseases. I see the impact of those diseases on their mental health. And so we advocate for integration of mental health in the management of non-communicable diseases and health in general at the level of primary health care. I thank you for listening to me today. I thank you. And the biggest thing I'd like to say is we need to decriminalize symptoms of mental health conditions, including suicide, by repealing Penal Code Section 226 to decriminalize suicidal ideations or attempts. So I call upon every Kenyan today, let us work together to help people like me to live deathless lives. Let us work together to achieve the highest attainable standards of mental health in every home, in every school, in every office, in every community in Kenya. Thank you.
Thank you so much, Charity. So the theme for mental health this year is working together to prevent suicide. And we are celebrating this day to demonstrate our commitment to reduce death by suicide in this country and among the mentally ill. But we must all work together, families, friends, governments, health workers. It's a duty of everyone. It's not just a duty of the mental health workers, but it's a duty of everyone. Now, I will call upon Dr. Oluga to just say something for 1 minute.
The CAS for the Ministry of Health, Dr. Rashid Aman, the Director General, Dr. Amwath, our colleagues, senior colleagues, Dr. Nyancha and Dr. Njuguna, representatives from the hospital, representatives of our clans. We didn't want to say patients, as now that you've mentioned 1 out of 4 people, the fourth estate and our colleagues, the health workers. Today is a day that we mark prevention of suicide, and for us as the Nairobi Metropolitan Services, through the Director General, is to mention that the efforts that are being put in place by the Ministry of Health are very commendable. Even during this time of COVID, most of the people who have benefited from support in terms of psychological support are healthcare workers from Nairobi Metropolitan Services, and even people in the Nairobi region, because as you know, we were the most affected and we are still the most affected with COVID, about 58 to 60% of persons. But even as we're talking about suicide, the situations in cities is fairly worse than in rural places, and the commitment from health is to continue working very hard to implement the policies from the Ministry of Health, as well as to ensure that people are living in conditions that enable them to seek care, including mental health care, when they need it. I know that Nairobi Mathare Hospital is managed by the Ministry of Health. It's not our facility, but of course, majority of the people who come here on daily are people in Nairobi. And there are also so many other people who do not come here and they seek services in our facilities. And we are making all our facilities mental health friendly, but not just in the facilities. We're also reaching out to the communities to make sure that we promote the message of suicide prevention. And we are telling everyone in Nairobi to reach out, to listen to people, and to take people seriously, especially so when they suspect that someone at home, someone in the family, someone that they love, someone in the community is mentally unsettled. With those very many remarks, I want to thank you very much, and I want to wish that we continue to pull together to prevent suicide in this country. Thank you.
Thank you so much, Dr. Oluga. I will now call upon our Director General, who will make a few remarks as he welcomes the CAS. Thank you so much.
Thank you, Dr. Ari. The Chief Administrative Secretary in the Ministry of Health, Dr. Rashid Aman, colleagues from the Ministry, the MedSup, Mathare National Teaching and Referral Hospital, colleagues from the estate, fourth estate, good afternoon. Today is an important day as we mark the World Suicide Prevention Day. This comes in the midst of a pandemic that we have been dealing with since March, the COVID-19. COVID-19 has further compounded the risk of mental health in our society. Many more people are presenting with stress, anxiety, depression, and of course the attendant consequence of COVID-19, which is stigma. It is for this reason that the ministry has prioritized the implementation of the report of the Mental Health Task Force that was submitted to us a few months ago. And part of this has involved including what Madam talked about, recruitment of psychologists. For the first time in the era of the Ministry of Health, we have psychologists as part of the mainstream health workforce to be able to support us. And it is our feeling that these services need to be taken closer to the people at the county level, sub-county level, and even at the community level to be able to stem the rising burden of mental health problems. We shall continue to partner with the ministry, with this hospital, and other partners to ensure that we prioritize mental health. In fact, during the 11th Extraordinary Summit between His Excellency the President and the county governors, one of the directives we are given was to be able to come up with the key recommendations that we are going to implement in the next 14 to 21 days regarding mental health because of the increasing burden of the problem. And the team at the ministry under the leadership of Dr. Njuguna and Dr. Nyancha have done a fantastic job. We already have that presentation, which we are going to share with the counties to see how we can be able to work together to ease the burden of mental health going forward. With those few remarks, allow me to invite the Chief Administrative Secretary of our ministry, Dr. Aman, to make brief remarks and also take us through the daily presser. Waziri, karibu.
Thank you very much, and good afternoon to all of you. Today is an important day. As the World Suicide Prevention Day, I think the idea of commemorating a day such as the World Suicide Prevention Day is an idea that was well thought out, that is timely, and that recognizes the importance of mental health in our lives in the era that we live in today. Of course, for many years, mental health was something that we did not want to bring to the surface, something that we stigmatized and talked in hushed tones about it, whether in our households, in our communities, or within our society. But it is very clear now in this age of today that mental health still represents a very big part of the ailments, health ailments that face us and challenge us every day. For too long, mental health has been neglected, but I think it is coming to the fore now. And I know that the various actions that the ministry is taking and the government of Kenya, and I think they have been alluded to, are going to take us in the right direction in recognizing the importance of mental health, the importance of investment in mental health, so that we can improve the welfare as well as the mental state of our people too, so that they can be most productive in our society. Now, the first speaker spoke out very powerfully and pointed us, as a stakeholder, pointed us to some of the shortcomings in the way that we are handling mental health care. This institution that we are gathered at today is an old institution that has been around for a long time and was set up for a particular purpose. I think now is the time for us to pick up this institution, revitalize it, and place mental health at the right place that it needs to be. So in that regard, I think as a ministry, you will see as we move forward that there will be a lot of action taken in the direction of uplifting mental health and the effects of mental health in our society. With that, if you will allow me, I will now move into my official presentation today. We are gathered here today because of the World Suicide Prevention Day, and we are appropriately gathered as a facility that addresses this issue and in general mental health. So let me begin by saying good afternoon to all of you, distinguished guests, ladies and gentlemen. First and foremost, before I give our daily COVID-19 briefing, let me state why we are here in this magnificent institution, one of its kind in East and Central Africa. I'm glad to be here today to preside over the commemoration of the World Suicide Prevention Day. This day is organized annually by the International Association for Suicide Prevention and observed globally. The purpose is to raise awareness that death by suicide can be prevented. Globally, over 800,000 people die due to suicide each year. It is the second leading cause of death for young people aged between 15 and 29 years, the most productive age cohort within our society. In 2013, the Mental Action Plan 2013-2020 was adopted by the World Health Assembly. This action outlines suicide prevention as a priority, with the global target of reducing the rate of suicide in countries by 10% by 2020. We are already in 2020, almost moving towards the end of 2020, and I think we need to reflect back and see whether we have achieved that target. In the Sustainable Development Goals for 2030, suicide is a proposed indicator of health for some of the health targets. And this target aims to reduce premature mortality by 1/3 from non-communicable diseases through prevention and treatment and promotion of mental health well-being. Fellow Kenyans, here in Kenya, the number of suicide cases have increased in the last several years. A report by the World Health Organization indicated that the number of suicides reported in the country rose by 58% between 2008 and 2017. There are 317 suicide cases reported every year, although this morning I read in the newspaper a figure of 421. Still a large number for this country to report every year. The increased reported cases of suicide in Kenya shows the dire need for measures to prevent suicide. The World Population Review ranks Kenya at position 114 among 175 countries with the highest suicide rate. In addition, Kenya's suicide rate is at least 6.5 suicides per 100,000 people. The Ministry of Health is in the process of developing a national suicide prevention strategy and program 2021 to 2026 in line with the WHO guidelines. In response to the current COVID-19 pandemic, the Ministry of Health is providing mental health and psychosocial support as a key intervention in this response. During a crisis like COVID-19, most people will experience some degree of distress, such as feelings of anxiety, hopelessness, sadness, difficulty in sleeping, fatigue, irritability, or anger, and aches and pains. Although individuals respond differently, this is normal, and for the majority, it will improve and go away over time without any need for medical intervention. However, some of those affected may suffer from serious mental or emotional distress, including worsening of existing mental illness or resorting to substance abuse and substance abuse problems or acute stress disorder. A public health approach is therefore needed to address the psychosocial and mental health consequences of COVID-19. Fellow Kenyans, His Excellency the President, during his Madaraka Day address in June 2019, highlighted the growing concern on the increased cases of depression and the need for efforts to address the mental well-being of the Kenyan population. There have been persistent requests by Parliament as well and the general public for a national suicide response, including a national suicide strategy and a suicide hotline, hence the need for this intervention. One of the interventions to effectively address the growing need for mental health and psychosocial support for persons who are infected or affected by COVID-19, as well as the general population, is the provision of telecounseling and telepsychiatric services. And of course, during this period of COVID-19 pandemic, where we are encouraging social and physical distancing, the element of tele-services becomes very critical. I'm made to understand that even at the ministry and here at Mathare, we are considering setting up a telecounseling and telepsychiatry center here, which will also have a call center that will have suicide prevention hotline numbers that Kenyans can call into, receive counseling and guidance, and directions and instructions on where to seek appropriate care and for the conditions. The suicide prevention hotline will be a toll-free line, and many Kenyans will have access to it for mental health and psychosocial support. This 24/7 facility will enable the adequate utilization of the scarce human resource for mental health and psychosocial support. Callers will receive both emergency and non-emergency support. The hotline will be operational and continue to be operational post-pandemic to address mental health impact of COVID-19, not only mental health impact of COVID-19 on the population, but all other mental health challenges that we face as a nation. It will also enable follow-up of persons diagnosed with mental health problems or substance use disorders. Trained mental health personnel, including nurses and doctors, have been identified who will be on call and will work in shifts at this telecounseling and telepsychiatry center. These cadres will run the call center even as we await the deployment of the 40 psychologists who are currently in the process of being recruited through the Public Service Commission. The telecounseling and telepsychiatry center will also deal with other mental health issues, as I mentioned earlier, including attempted suicide, substance use disorders, crises such as drug overdose, psychosis crisis, and gender-based violence. It is expected that it will offer psychosocial support, including psychological first aid to persons in quarantine sites, currently healthcare workers, other frontline workers including morticians, persons with COVID-19 and their families, persons in recovery, families of the bereaved, survivors of gender-based violence, and the general public. They will also provide technical mental health care support to counties and healthcare workers, offer psychiatric consultation, public education on good mental health practices, and coping strategies. Besides, there will be linkage to ambulance services for response to mental health emergencies. Having said that, I also want to take this opportunity to thank all those healthcare workers whose day-to-day work involves taking care of mental health patients, addressing mental health issues in this country. And this institution is one of those where you will find most of these people. I want to thank them profusely because indeed, as the first speaker noted, they do work under very difficult conditions. Conditions that require us really to look at very carefully and improve those conditions and provide them with that enabling environment. And I can imagine how much we can achieve if we are able to do that, provide that enabling environment not only for the healthcare workers, but also for the clients that we see in our institutions. And I want to say thank you to Mathare National Hospital for the work you're doing in that area. Continue to do that work, and as a ministry, I think you have seen that over the past couple of years, the ministry is paying attention to the issues concerning mental health, and we will continue to do that. Fellow Kenyans, turning to our COVID-19 statistics, today 143 people have tested positive after testing a sample size of 3,854 over the past 24 hours. This brings the cumulative number of confirmed positives in the country since the pandemic broke out in this country to 35,603. At the same time, the cumulative number of tests that we have carried out stand at 485,836. The 143 positives over the past 24 hours comprise of 129 Kenyans and 14 foreigners. The youngest is a 9-month-old infant, and the oldest is 83 years. 85 are male, 58 are female. Distribution by counties, Nairobi is still at the top, registering 35 cases. Kitui, which we have seen coming up in the last few days, has registered 23, Mombasa 9, Garissa 9, Kiambu 9, Nakuru 9, Kilifi 8, Turkana 7, Kajiado 5, Machakos 5, Kisii 4, Kisumu 4, Embu 3, Uasin Gishu 2, Makueni 2, Trans Nzoia 2, Nyeri 2, Migori, Busia, Isiolo, Taita Taveta, and Meru 1 case each. The 35 cases in Nairobi come from Westlands 7, Makadara 6, Dagoretti North 5, Kasarani and Starehe 3 cases each, Embakasi East, Embakasi North, Embakasi South, Kibra and Waraka 2 cases each, and Roysambu 1 case. Kitui's 23 cases are all from Kitui West. In Mombasa, the 9 cases are from Kisauni 8 and Mvita 1. The 9 cases in Garissa are from Dadaab, Fafi, and Garissa Town, 3 cases each. Kiambu's 9 cases are from Kabete, Kiamba, Kiambu Town, and Ruiru, 2 cases each, and 1 case from Kikuyu. Nakuru's 9 cases are from Naivasha 6, Nakuru East 2, and Nakuru West 1. I will not go through the rest because it will be available in the document once you have received it. On a positive note, I am delighted to inform you that 490 people have recovered from the disease, 248 from the home-based care program, and 242 discharged from various hospitals. This brings our total recovery to 22,047. And as usual, we want to pause at this moment to convey our gratitude and appreciation to our healthcare workers for the good work they continue to do that has enabled us to achieve these results. Unfortunately, we do from time to time also register deaths, and today we report that we have lost 5 patients to the disease, bringing our fatality to 612. Our sincere condolences to the family and friends of those who lost their loved ones. Finally, I want to remind you that mental health is critical if we are to successfully manage COVID-19 during these difficult times, but prosper also as a nation as we aspire to our Vision 2030 ideals. This requires the immediate and continuous provision of adequate mental health and psychosocial support, which will not only deal with the clinical aspect of mental health, but also the communal perspective. I thank you. Cover 2 questions, yeah? If there are no questions, we want to thank you. And again, you know, we had another function today that took a while, and that is why you had to wait for a while. But we have done it, and thank you once more. Be done yet. We have to do 1 or 2 things, and we will be guided on what we are going to do. Dr. Ari, you can guide us.
So we will all stand up for a moment of silence for all those persons who have passed away after when they died of suicide. So we will stand up for a minute of silence, and after that, we will light up candles for each of those persons. So the 1 minute is over. We will commemorate those who have passed away due to suicide. Wacha